All right, hello everybody. Welcome back to another version of Heads Up Office Hours. We're doing it a little bit different this time, but I'd love to just do a quick round of introductions now that TJ shut up. Hello, TJ. So just quickly again, my name is Nikki. I do sales and marketing here at Heads Up, and I'll kick it over to Brian for his introduction.
Hi, I'm Brian. I do the customer support here at Heads Up. If you have any questions, you can reach me, the little blue message icon in the lower right corner.
Awesome. TJ?
You bet. Hello, everyone. Happy day. I lead our sales team working with our clinical practices that roll out our platform and for their patients and clients, whether it's cash pay or an insurance practice, helping them roll out our remote monitoring platform and be successful. So yeah, that's my focus.
Awesome, thank you. And he has our cool dashboard as his background.
It's true.
Right back there. All right, Dr. Lewansky, it's all you.
TJ standing out in the crowd. So yeah, I'm John Lewansky. I'm the Chief Medical Officer at Heads Up, and I'm going to be talking today about glucose monitoring. So I'm the medical influence on the back end, working on all the courses that we're going to create and making sure that our product is matching what practitioners need it to actually do.
Absolutely. Thank you. Yeah, we're super excited for this one. We're going to have a little bit of an educational spin. So as mentioned, here in a second, I'm going to turn it over to Dr. Lewansky. He's actually going to do a presentation for us on best practices for glucose monitoring in your practice. So we're going to hear a little bit about that from him. And then we're going to turn it over into our brand new feature, the Photo Food Journal. We're going to do a demo live of that for you. And then we're going to end it all off with just a couple of questions and open the floor, obviously, to all of you for your questions. So if you do have any questions throughout any of Dr. Lewansky's presentation or throughout the entirety of the office hours, feel free to drop it in the chat box or the Q&A box, or you can even ping to come on live and I'll let you in and you can ask your question live. So having said that, I'm going to turn it back over to Dr. Lewansky so he can kick off his presentation and we can learn about glucose monitoring.
Okay, let me just share my screen here.
Sure.
Okay. I'm old, so just bear with me with the technical difficulties. Let's see. Okay, can everybody see my screen?
Yes.
Let's do this. Okay. Yeah, so the way we're going to kind of do these are going to be very kind of interactive. So as Nikki mentioned, feel free to stop me and ask questions as we go. And I was telling Nikki earlier that I'm so used to lectures and people telling me things that it just makes me tune out. So I'd rather not sit here and lecture to people about what to do, but because I think most people have a pretty good understanding of, the topics that we're going to discuss, but I wanted to kind of give insights to maybe certain things to look at in terms of how to really monitor certain metrics and think of things that maybe are a little bit outside the box. So for glucose, I mean, I think most people have a pretty good understanding of it, but what I wanted to talk about, let's see, is kind of the topics to cover. So just basic glucose physiology, not diving too much into it because that would be, a month presentation. Kind of the reference ranges that you have to abide by, if you are obviously a physician, healthcare practitioner, but even as a health coach, still, if you're billing Medicare or insurance companies, you still have to abide by certain guidelines. But then, what are certain influences that affect glucose metabolism? And then what are some alternative influences that maybe you don't think about overtly? Because, as healthcare practitioners, we're learning more and more about there's significant influences beyond just your basic understanding of glucose metabolism. Again, these are going to be super brief and overview because each one would be literally a month of discussion in terms of getting into the depth. And then if there's any questions, feel free to stop me. Nikki, if you can just kind of stop me if I'm too monotone or if there's questions.
No, you're fine. Actually, we already have one that just is asking to be covered. Just say, for example, a client doesn't qualify for a prescriptive CGM, how you would cover the costs or what are some costs associated?
Yeah, that's a good question. Unfortunately, for right now, there's two major players on the market. So there's the Dexcom, and then there's the Freestyle Libre. Insurance, you have to meet certain criteria to get the Dexcom or the Freestyle Libre, meaning you have a diagnosis of diabetes or prediabetes. And the Dexcom specifically is very expensive relative to the Freestyle Libre. So if you have a client who's paying out of pocket cash, my recommendation would be to go with the Freestyle Libre, which are actually not that cost prohibitive. So you either get the sensor, or now they have it where you can have an app on the phone, and then each sensor, depending on where you are, and if you use things like GoodRx.com, you can get them for anywhere from $25 to $30. So for some people, it might be a good way to start kind of closer monitoring of glucose. And a lot of times what I'll do, if it's a cost issue for people, is either include one of those sensors as part of a package that I would do, or have them pay out of pocket for one. And you can gather a ton of data because they're 14 days of information. You can gather so much data in that 14-day block period that you probably won't even need to use it continuously going forward. Maybe if there's significant lifestyle changes in the future, you might want to do it again just to see kind of how people react to it. But you can get a lot of data just from a short period of time that you can use going forward. And so maybe do that and then use something like Keto Mojo. Because in terms of glucose monitoring, generally the morning reading, in my opinion, is best information. Obviously if you're using a continuous glucose monitor, you get a ton more information, but not everybody can do that. So in terms of basic glucose physiology, this is probably super redundant and making people tune out already, but I wanted to go over just something basic in the sense that everybody's body has mechanisms that are active and counteractive. And so there's certain things that are very important for the body to regulate in a very tight window. Things like sugar or glucose is very important to have a tight regulation. So there's so many mechanisms, counter mechanisms, to make sure that you don't get a blood sugar that's significantly out of range. And so the reason for that and other things that the body will regulate really tightly are things like acid base levels, temperature. And so you have many mechanisms to make sure that you maintain a tight range. For glucose specifically, if you go less than 60, traditionally that's considered hypoglycemia. Anything above 100 is considered hyperglycemia, or 90 in some certain areas of the world. And so the way that your body really is going to regulate glucose specifically, the two major hormones are going to be insulin and glucagon, which are going to be counteractive against each other. And again, I'm not going to go too much into it because I think most people know that, but I want just that idea to remain, because as we go forward, there are certain things that I'll talk about which will influence insulin and glucagon. And so it's important to realize that there's other influences besides just dietary. So sorry, it's a little blurry, but just for billing purposes and for documentation purposes, you still have to go by the reference ranges that insurance companies and guidelines go by. So basically, fasting glucose less than 100 is considered normal. Some areas less than 90. High risk 100 to 125, and then diabetes 126 and above, and that's fasting. And then hemoglobin A1C, again, less than 5.7. You can see kind of the ranges. Of note for the hemoglobin A1C, it's a good measurement in terms of just kind of your average individual, but there's issues with it that I think are important to realize. And most people probably know this, but things that increase your blood cell turnover, things like thalassemia or sickle cell, will artificially lower the number, and then vice versa, things that maintain your blood cells at a lower level turnover will artificially raise that number. So you have to kind of use that with a grain of salt. The only other issue with using hemoglobin A1C as a metric of people's kind of diabetic potential is that you're really missing a 5 to 10 year window where your insulin level is going up. And so just the basic concept, let's say you're drinking Coca-Cola and it's pure sugar. As you drink glucose that's coming from the Coca-Cola, it's going to raise up in your bloodstream. Your insulin is going to respond to that and drop the blood glucose. Now, as your body's ability to do that and respond with insulin appropriately, your hemoglobin A1C may remain normal. And so you might go to your doctor, or you might have clients that come to you, their hemoglobin A1C is normal, and you say, okay, everything's good, continue what you're doing, continue drinking your Coca-Cola, everything's fine. But you're missing the big window period where your insulin level is going through the roof. Eventually, as you continue down that path of using a lot of glucose, your glucose levels go up and your insulin levels respond, but your body cannot respond enough because you have insulin resistance, or your pancreas gives out and you're not producing enough insulin. Then you'll start seeing a rise in the blood glucose, and that'll be reflected in the hemoglobin A1C. But you really have been doing damage with that hyperinsulinemia for anywhere from 5 to 10 years. And so I think the goal with a lot of practitioners through Heads Up Health platform is being able to kind of get that time period where people are obviously showing signs of prediabetes or before hyperinsulinemia, and making sure that you get on top of their program, whatever program you're doing for them. Are there any questions so far? Thank you. Because I can't see.
No, they're not, but I have one. So
Sure.
if you were a practitioner in that setting, then what are if you're looking at that like 5 to 10 year window, in context of Heads Up, then what are the markers that you're looking for that are presenting themselves, through the dashboard? Would this have to be through the hemoglobin A1C, or can you tell this by their glucose measurements at this point? Or are there other like physical or other markers that would show, pre-diabetes, diabetes?
Great questions. So there's a couple ways that you can really kind of answer this question. So through the Heads Up dashboard, let's say, going back to your question about a continuous glucose monitor. So one way that you can tell if somebody is kind of indirectly having an insulin response that's disproportional to what they're eating is the delta. So the rate at which your glucose increases is important, but even more important is the rate at which your glucose decreases. So again, using the example of like a soda that's just pure sugar, as you get that spike up in your blood glucose, let's say you have a CGM, so you'll see it, right? Instantaneous going up. And it's not instantaneous, it's like delayed by 15, 20 minutes. But for our purposes, let's say it's instantaneous. What's almost even more important is how quickly do you go back down to your baseline? Because that's the impact of insulin. So if you are getting a robust insulin response, and you're not insulin resistant, meaning that your muscles are absorbing the glucose, your liver is being able to absorb the glucose, you will see a rapid decrease in your glucose. Now, if you are starting to get into a period where maybe you are not having the same responses before, either you're more insulin resistant, so as your insulin response goes up, your body's not absorbing that glucose, you'll see it spike, and then it'll kind of slowly come back down, and maybe won't come back to baseline again. Conversely, if you get to a point where your pancreas really is not producing the amount of insulin that it needs to respond to the glucose, you'll see a spike, and it'll probably stay up much longer. And so in those situations, what you'll see is a fasting glucose may be, not in the 80, 90 range, but it'll be in the 130 range. And then when it spikes, it'll go up to 200, 300, and then kind of stay there for a lot longer. So you can measure the time duration. So how long does it take to get back to baseline? And then how high is the spike? So that's if you have a CGM. The other things that you can do with the dashboard, there are lab tests that you can do. There's a company that's working on getting a home insulin test but it's not really viable yet. It's very expensive. Eventually, I think we'll have home insulin tests available, and then obviously we will be able to integrate that into the dashboard. And I think that would be a game changer. And if anybody's working on that, hit me up because I want to know about it. But for now, what you can do is we have like an NMR lipid profile, so that'll tell you your basically your insulin resistance score. So you'll have an idea over time, am I getting more insulin resistant? So that's another way to do it. And then if people are checking ketone levels, they'll also see a suppression in ketone levels. So that might be a way to do it. And then there's a lot of indirect measurements that you can look at. Sleep patterns, high sensitive CRP would be elevated in the pre-insulin or the pre-diabetic insulinemia state. So there's many ways to kind of indirectly reference that.
Interesting. Thank you.
Mm-hmm. So, in terms of like major influences on glucose metabolism, obviously dietary intake is number one. And this is a very kind of an area where you have to be a little bit careful in what you say, because the guidelines that MDs, DOs, anybody who's licensed by a board has to follow is a little bit different than what I think a lot of health coaches or alternative health practitioners will look at in terms of carbohydrates, especially refined carbohydrates, high fructose corn syrup, significantly influence how glucose is metabolism, either directly by the amount of glucose you're consuming or indirectly by fructose causing insulin resistance in the liver, etc. Again, insulin is a major influence, like I kind of mentioned, but there's things that I'll talk about next that can influence insulin, besides just your dietary intake. And then the counter-regulatory glucagon, which is important. It's not really measurable, so we don't really talk about it, but it does have a significant impact in terms of metabolism. And then exercise movement, on the one sense, there is a fallacy that the amount of calories you consume does not influence your ability to lose weight or gain weight. There still is a energy demand component. And so if you're moving a lot, so a lot of athletes will have higher resting glucose rates because they have a higher demand. And they have usually a higher insulin level as well. And then medication, obviously people are on medication for diabetes management, but other medications can also increase, your resting glucose. Unfortunately, our major kind of way of treating diabetes and pre-diabetes before you get to the insulin stage is through medications that, either try to improve insulin sensitivity or increase insulin output. And so we're kind of masking indirectly what we're trying to accomplish by, raising insulin basically, which is kind of adding fuel to the fire. And so you'll see in clinical experience, a lot of people, are at the pre-diabetic stage. They'll be put on metformin, maybe have a little bit of success, but the dietary changes don't change. And so they'll kind of go down the path of adding more medications, eventually getting to a point where they need to be put on insulin. And once people are put on insulin, it's basically game over. You can never lose weight, essentially, because you're basically adding fuel to the fire that's causing the weight gain in the first place. Any questions on that?
Not so far. Nope.
Okay. And so, with heads up, one of the best, I think, components of it is your ability to see over time what the glucose measurements are. So this is just an example with the Keto Mojo, which is a very good device that shows you, number one, obviously you have to check it. So this person hasn't checked it very much, but even with few data points, you can kind of still see over time what the ranges are. So I think it's important. You don't see massive spikes. I mean, the highest is 109. But then the benefit also is you can smooth it out. So you kind of, let's say you have a lot of data points, the ability to smooth it out, I think it really helps in terms of visualizing, what the kind of ranges are with the glucose. And Yep. So what I kind of really wanted to talk about, though, which I think is also extremely important for people, is to think about the other influences on glucose and like what else can really trigger it, either low glucose or high glucose levels. So one of the ones that is probably the most important besides dietary is sleep. So sleep is extremely important in terms of regulating not only circadian rhythm, but also hormonal like balances in terms of stress and things like cortisol. So having poor sleep, and the way I approach it with a lot of people is, I think in Western medicine, we tend to compartmentalize things where we say, okay, if you want to lose weight, you just have to fix your diet or you have to exercise. The reality is that if you sleep poorly, you're going to have a very hard time of losing weight because you're going to increase your cortisol levels by having poor sleep. And that's going to preferentially make you want to eat more carbohydrates, like refined carbohydrates. Anybody who's pulled an all-nighter knows like they're starving and the only thing they want to eat are like sugary things in general. Yeah. I mean, I used to, work 36-hour shifts and I was just like a madman. I would just eat whatever was there. And in the hospitals, of course, they have like, crackers and cookies and cakes. It was amazing, but not something I would recommend. But the importance of it is to focus on things like, and I just want to go to the next slide because I think this shows it very well, where there's so many factors that influence your metabolism. And I think for a lot of people who are using Heads Up as a coach or a healthcare practitioner, or even as an individual, weight is probably one of the major issues that they're focusing on just based on our population. So I like this one because it really shows the juxtaposition between blood glucose from a CGM and sleep data. So an HRV being the sleep data. So the kind of purplish line is your HRV over time. And that's kind of a measurement of your overall stress level, let's say, for these purposes. And usually it's highly influenced by sleep. And then the blood glucose are the blue ones. And this is daily, so it's showing your range. And as you can tell, there's kind of a indirect correlation. And you can especially see it when, let's see if I can use a pointer, when you see significant dips in HRV. So low HRV numbers, for those who don't know, is usually a reflection of significant stress, poor sleep, either being up late at night, but it's usually correlated with a much higher average glucose level. And you can see that here again. And conversely, as your HRV improves, your resting glucose, which is reflected here, becomes much tighter and much better. So going back to the other influences, I think sleep is extremely important. So you have to really, once you've established, okay, dietary, maybe exercise, and I'm still having trouble maintaining my glucose control, what are the other things to look into? And that's what I think Heads Up is really good at, is it can give you inferences into, okay, my sleep is really bad. Now, when my sleep is bad, my glucose is very high. So, okay, I need to focus on sleep with this individual. Same with stress, as we talked about before. So stress can be reflected in the HRV score as well. It can also be reflected in your sleep scores in terms of, are you getting a lot of deep sleep, REM sleep? Sometimes those will significantly be impacted with stress. You can look at your, high sensitivity CRP. If it's high, if your cortisol is high, I know we're doing the Dutch test. You can tell, okay, when my cortisol is very high, my glucose tends to be high as well. So I need to get the stress levels under control, which these days is really easy to do. And then utilization, I kind of mentioned it earlier, where you still have to, use the energy that you're consuming. So if you're consuming, massive amounts of calories, even if you're ketogenic like I am, there's a fallacy to think that you can consume, 5,000-6,000 calories of mostly fat or protein and still lose weight. You really will not be able to. And so you'll see that reflected in starting to see higher resting glucose levels. And then I put insulin resistance down there too, because how much damage you've done to your body over time really impacts how easy it is for you to get it back under control. So somebody who maybe has 5-10 pounds on them and really has a low resting insulin score will have a much easier time than somebody who's, significantly obese, has a very high insulin score. And people get frustrated because, you tell them, this is what you need to do, but somebody who's insulin resistant, it will take a lot longer to get back down to where they want weight loss wise, and then also metabolically wise. And so you might have to structure your programs a little bit differently depending on what the starting baseline is for individuals.
Great. Yeah, that was absolutely going to be my question. Obviously, there's a correlation between, damage done and reversal time. And I think something that Heads Up is really good at is looking at, the N=1. Everybody's different. We're all going to require a personalized protocol. So my question for you, looking at those, those 4 quadrants of things that affect glucose in terms of, interventions and interventional reversal. It's recommended, I'm assuming, to adopt one at a time and begin assessing, because everybody's, sleep, it could be affecting, stress could be affecting, your diet could be affecting, and do one at a time, would you say, or should we approach all of them, depending upon someone's level of metabolic dysformation?
Yeah, great question. So, one of the things about Heads Up that I think is great is I always start everybody out with a basic, blood panel. So having the data to say, okay, what am I working with metabolically? Because I think we focus too much on external appearance. So is somebody obese or not obese? And we use that as a determination of their overall health, which I think is inaccurate. Some people can just genetically or ethically have a little bit more subcutaneous fat, and that's a very different type of fat than like a visceral fat, and that'll be reflected in somebody's lab data. And so having that ability to input the data and see, okay, what is my fasting glucose, what is my fasting insulin, what is my CRP, what are the specific lab markers that I'm looking at, and how much damage has been done metabolically internally. Based on that, I will usually start with one thing specifically, and obviously having an assessment of kind of what is the overall picture of that individual. Like, are they working nights? Do they have swing shifts? Like, what is their overall? Do they have 3 little kids and they're stressed out of their mind? Are they a professional athlete? Like, there's so many variables that go into it, but in general, I think my focus and using Heads Up Health to kind of reflect this is what most, I think, healthcare practitioners are going to do is to try to find a way to maintain somebody's health long term. Not just doing a quick diet, lose 30 pounds and then go back to what they were doing. It's a lifestyle change, right? And so to be able to maintain a lifestyle change, I think it's very difficult to do multiple things at once. So I usually do almost like a step up pattern where start off with the one thing first. And that thing usually is nutritionally, because I think that has the most significant impact on people. So very simple, depending on what they're doing, getting rid of refined carbohydrates, getting rid of sugar, basically things that are excess that are driving glucose and insulin response. That's number one. If you do that, I think you significantly improve 99% of the population. But then also looking at things like alcohol intake. Alcohol has a significant impact on things like that, and that tends to be a little bit harder discussion with a lot of people. And then moving on. So once you have that dialed in, and not over like a week period, I'm talking 3 months of just hardcore dialing in, because not everybody's comfortable doing a strict ketogenic diet, and I don't think everybody needs to, but doing a low carb diet or just doing like a paleo diet or a whole food diet. I think there's many ways to approach it. Some people are even successful doing a vegan diet if they're starting and doing it right. So I think there's many ways to approach it, or like a carnivore diet, which I always give carnivore people a hard time, but it works because there's validity behind it. So once you have that dialed in over a 3-month period or so, then building into it. So next thing, okay, let's focus on sleep. Let's focus on exercise. And using the data from Heads Up to see, okay, what's the response been? So, rechecking labs or using the CGM or using ketone measurements, using HRV, using sleep data. All those things I think really give you a good overall picture of somebody's health. And I think that's the beauty of it, of the system, is that you can see multiple different layers into somebody's health by looking at different parameters. So yeah, I mean, that's basically it. I know it's supposed to be like a 10-minute thing. So
No, that was great.
any other questions? I think going forward with these things, maybe we put out, what the topic is going to be and if there's any questions that people have specifically, so we can address those. And then really they'll be very like short, kind of maybe alternative things that people don't think about.
Yeah.
Assessing health. Yeah.
Absolutely. No, that's a really great idea to assess some questions beforehand and make sure we hit them in the presentation. I am absolutely recording this and we can share it with everybody. And I'm going to encourage anyone and everyone to watch that because that was amazing. I liked it. I totally geeked out over that presentation. So thank you very much. Dr. Lemansky, that was great. And it was a perfect sort of segue because what we talked about here, metabolic optimization, your first step is going to be some sort of a nutritional intervention. So having said that, we recently released the Photo Food Journal. So it's just a quick and easy way for the practitioner to check up on really nice Instagram style images of, the food log of their clients to make sure they're adhering to their nutritional protocols that they've set them on. So just quickly, TJ and I did a quick little demo of this, but I'm going to share my screen and share this with you guys again, just to show you how easy and fun the Photo Food Journal is. So just as soon as you jump into your account, you're obviously going to see your clients table. And you can pop into your client here and view their dashboard. And so the first step is going to be what's done by your client. They're going to see Photo Food Journal on the left-hand nav bar, and they're going to hopefully remember prior to eating their food to snap a quick picture and uploading it into the Heads Up account. I personally sometimes do this with Instagram. So I have a lot of stock photos or just photos of my own food on my phone. So I will be sure to do this in the future. Just another place to add them. So they come over here into the food journal. And so you'll see once this loads that I already have a couple historical entries here that I have labeled both breakfast and lunch. So it's a super easy way to just see images of your client's food choices. And all they would do is they would come over here and they could upload from the phone or the web just a picture of their most recent meal. So I have this nice little salmon, wild rice, and broccoli that I found offline. I'm not this good of a cook, but you can add the date here. They can select what meal it was, and they can add some comments in terms of, what's included, what they cooked it with, what sort of oil were they using, and just add the entry here. One of the most beautiful things about this is once this shows up and you go ahead and take a look at it, it is able to be communicated directly on the file. So if you come in here and you wanted to add a comment about what they ate, maybe you want to add some veggies next time, you can do so right here onto the comment, and they'll be able to see this once you hit send. And they could come back on here and add their comment too, and you could have a conversation directly here on the file. So this is our Photo Food Journal. It's a great new feature, especially for monitoring nutritional choices and adherence to protocols. A little pro tip I was thinking about, if you wanted to go a little bit more in depth with communicating about their nutritional protocols or restating what it was that you shared with them, you can always take this file and put it into a note that's directed towards your client and reinforce what your protocol was, perhaps by including the template of your nutritional protocol again. So that's just kind of a quick way that you can use the Photo Food Journal outside of the feature part of the portal right here. So having said that, I'll go ahead and stop share of my screen and see if anyone has any questions about the Photo Food Journal. It's super fun. And if not, we're going to move on to some questions. This is Brian's favorite part. Awesome. Okay. So we have a few questions prepared for you guys that some of the other data-driven pros have submitted to us within the past month. And the first one I am going to give to you and then turn it over to Brian to give his lovely answer and demo. So we had somebody say, I'm only seeing my client's email address and last login information when I sign into my portal. How do I customize and organize my client's table? Oh, Brian.
Awesome question. Let me share my screen and show you how.
Sure.
Can you see my screen?
Yes, I can.
Okay, so you won't see the email here. That's just to keep my clients confidential. When you first land on the client's table page, you're not going to see much data. In the top right corner, you're going to see a little drop down with either the number 1 or 2. Click this, and then you'll have all of the options to add metrics to this table here. Let's go ahead and add some metabolism. We'll add glucose just to go along with Doc's theme. Once you add it, it appears on the dashboard. We could add a couple more. Let's add a couple sleep metrics. Sleep, deep sleep, and HRV sleep. Once the metrics are on the table, you can drag them if you'd like. They're not permanent. You can move them to wherever you'd like. And you can also remove them. If you didn't want to know the last time your clients logged in, you could go into System and remove Login. If you'd like to see their emails, you can click Email or Remove Email if you'd like to see that. Another great feature on the clients table here, if you click the drop-down arrow in the far left of the client table field, it will open up to give you more data about the what's being shared. So you'll get the most recent reading, so the date that they recorded it, the day, the week value, the month average, the year average, and the lifetime average. It also shows you the source. In the event that there's no data here, it generally means that the source is set to something that you weren't expecting. In the event that you needed to change that, you can view the client as the dashboard and adjust the tiles accordingly. If the data here isn't fresh, you can always click the refresh button in the bottom, and it should refresh it if there's data pending.
Brian, are you sharing another screen? Are you sharing two different monitors?
I am not. No. Oh, yes. I am.
Okay. I just see the clients table. That might just be on my side. It looks. Dr. Lemansky, what do you see?
Yeah, I see the same thing. Yeah.
Okay.
So the screen's not responding as I click? Is that what you're saying?
Yes.
Oh, okay. Yeah, so it has frozen.
Okay. That's okay.
Okay.
It's frozen on a really great screen though.
Well, let me stop sharing and see if I can refresh it. Bear with me.
No, you're fine. So yeah, the clients table is completely customizable. And then he was just showing a way that you could see some additional data by the same view and just clicking one little more arrow.
Can you see this one?
It's getting there, it looks like.
Okay.
I still see you started sharing screen and nothing yet. That's okay. It's no worries at all. I think people. You want me to try to share mine?
Yeah, if you'd like.
Sure. Okay. And you can still talk through it. So here we're just looking at if we click the down arrow, right?
Correct, yeah. So the down arrow just highlights more of the data. So if you didn't see any of this as I was discussing it, I was just showing you the biomarkers on the left. It'll show you the most recent date that the biomarker was recorded, and then it'll give you the day, the week average, the monthly average, the yearly average, and then the lifetime average as well. And on the far right, you'll see the source. This is the source that's sharing this data. Another great feature here, if you click on any of the underlined values, they will automatically be graphed on the reports page inside of the client's view. voila. So it should open the date and it should graph it here. Perhaps there isn't any data.
There might not be any data. Might have clicked on a different one.
And then to get back to the client's table, we could just tap cancel on the top of the screen there.
And we're back. Yes, perfect. Thank you. So that's just, this client's table is completely customizable. You can move these around depending on what's important to you in the order that it matches your client's dashboards, and just so your view is exactly what you would want it to be. Thank you, Brian. And our very last question before we kick it off, it's just very simply, I want my portal to feel more a part of my clinic brand when clients log in. How do I add my logo? So adding logos inside of your portal is a white label feature. And all you would do here is contact your sales representative. It might be Chuck, it might be TJ, and ask them to help you out with some of our white label features and getting the logos added into your dashboard. Let me see if there are any questions. Chuck, thank you for those. And we don't have any more questions. So guys, thank you very much for the presentation and helping us answer questions. And again, we will have all of this recorded and reused and reshared for everybody, so you can have all the answers to the questions and also that fantastic presentation by Dr. Lemansky. And we'll get people in here. I would say next time we'll probably do more of a meeting style, so we can have a collaborative conversation and you guys can just pop in and ask some questions whenever it feels good for you. So having said that, thank you for showing up this time, and we'll see you in May.